introduce our guest speaker, Professor Wai-Ching Lam, and he's a medical director of the ophthalmology department, and he's a clinical professor in Department of Ophthalmology and Visual Science at Vancouver University in British Columbia, Canada. Professor Lam is highly well known for his expertise in ophthalmology and his contribution to advanced clinical practice and research in visual science. Please join me in welcoming Professor Wai-Ching Lam for this talk. Thank you.
So thank you, Dr. Ramsey, for the introductions. I'm asked to give a talk on the leaderships and professional. So it is not something that I kind of routinely give, so I'm much more comfortable talking about clinical scenarios and work. So I will welcome any kind of feedback afterwards and discussions. And so the topic is mastering difficult conversations for the medical leader. So why we need to get comfortable with it? I think as you can see that a team kind of development and safety and trust among the team members really depends on effective dialogue. And if you try to avoid the discussions, it actually costs you more than having one. And the important thing is that the difficult conversations or topic doesn't mean that it is bad. So maybe just, I think we have a small group here, so raise your hand if you ever delay your conversations that you know you need to have, but you just don't want to do it. Yes, thank you. A few of you, so you may find some of this may be helpful. And so the question is, like, what makes the conversation difficult? Is the timing of the conversation? Is that the emotion attached to the conversations? Or is it hierarchy? You have to talk to the boss, or is it certain uncertainty of the topic that you want to talk about? And I'm not going to, since we don't have a polling mechanism, we're going to skip that. Maybe perhaps we will say, as I mentioned, why does it matter? Because I think it will help to develop patient safety, team trust, and giving you credibility as a leader, and raise the morale and keep your staff. So I titled this The Silent Epidemic, and it's been described most of the medical errors start when the conversation didn't happen. And so imagine, think about this, what does the cost of silence in your hospital is. And so mastering the art of difficult conversations has become a very important skill for the leaders and for employees. And whether it was navigating through some conflicts or delivering a constructive feedback or discussing a sensitive topic, the ability to able to kind of have a tough conversations and with grace and effectiveness is quite important, and it can impact the team dynamics. And working through the discomfort of this difficult conversation is very crucial for both the kind of the personal perspective or the organizational success. Even nowadays, the university actually have provided like workshop to help train people to manage this kind of tricky and difficult situations. And although you can plan some of the conversation ahead of time, but sometimes it may happen spontaneously at work, so you have to figure out a way to deal with this. So here are some of the tips that for a successful kind of planned discussion or conversations. So first of all, it's important to know what you want to talk about, and then you try to gather the information around the topic so that you have a meaningful conversations. Try to pay a right time and a place. So don't do it in the corridor, especially if it's sensitive information. Don't talk in front of your friends or other people that may feel like uncomfortable. So pick a place. And at the end of the day, it may be exhausting, so you may want to do it a lunch break or a coffee break so that it will be a little bit more relaxed. And you open the conversation with empathy. Don't be critical, like, because I think if you want to have a meaningful discussions, you need to show that you actually concern, care. And then you should have anticipate the reaction that comes along, and then try to have a common ground so that you have communication between you and the person. Remember to pause before you respond. Don't quick to give your reactions or your questions or even your answers. Give that moment of stop. It gives you a bit of time to think and give the other person to kind of take in what's been described. So if there was something that surprises you, acknowledge that. And then try to seek clarity, say what was the reason that you get surprised, what was the problem, and then kind of remember you should listen, and because it's a two-way conversation. You talk, you also listened. And maintain a calm demeanor, because if you are all excited and nervous, it only makes it difficult for the other persons. And if there's a policy, there's a protocol that apply to this situation that you're in discussions, use that. And then remember, you may want to follow up meetings if it become appropriate. Okay, so that was good. But then how do you start? Now, I'm going to use the rest of the time to give you some tips to do and then some kind of way to think and organize your thoughts when you actually start that conversations. So the first thing to do is prepare your mindset. Get ready for that conversations. So, because it is important to know, like, you don't want to be judgmental. You want to be kind of prepared, but at the same time, you want to have the conversations. So you want to know, so what do I value about this person and the relationship? Not what I'm afraid of this person. And what do you think, what I think of important about the person, not the negative part of what I don't like about this behavior. And what strength does this person bring to work, and not their weaknesses. So now prepare your mindset though. It's very easy to slip into the judgmental. So open with empathy and non-judgmental description. So think of that, they are my peers, and they are excellent physicians, and I liked our relationship. And it's important to understand their autonomy. Maybe that's the reason why that they behave certain way. They want their freedoms. And the strength of this person may be just that they have excellent patient-client communication skill, and we should probably recognize that, and that may be the reason why you want to bring that up as part of the conversations. So let's go through some practical suggestions and strategies for carrying out difficult conversations that I learned from attending the difficult conversation workshop that I was in Vancouver. And so there are three fundamental strategies for leaderships when you have a difficult conversations. So the first strategy is the 3 level of listening and reflective response. I don't know, have you heard of that? And the first one is listen for the facts, and then reflect on the facts. And the second one is listen for the feelings, because often in the conversation you can actually sense the person is it depressed? Is the person angry? Is the person unhappy? And then in your conversation you can reflect back on that feeling that the person have. And then listen for value. And so the value here is probably what is the relationship to the department? Does it affect the reputations of the department or the hospital, or the reputation of the individuals? So here, so how you start, say, so if I heard you correctly, this happened, and then this follow up. So that could be the way you can start the conversations. So you relate it to the fact. So I say, I'm hearing that you are not, let's say, picking up your phone call, and I understand that the other side, the medical consultant, was very upset at you. And then you say, well, you hear a response, and you say, wow, it sounds like that you may be very unhappy, or very busy, is that the reason why? And then in terms of value, you can talk about, so I get the sense you are a little upset because you really care about the reputations of your department or really care about how you conduct yourself. So those are kind of the tips that you can start your conversation with, some wordings that may be useful to use. But importantly is that you need to kind of get back and confirm with the person. So did I get it right? And is that what you're saying? And how does my conversation land with you? Now, before you give your response, remember I said pause. Stop for a moment, count to 5 seconds, 5, 4, 3, 2, 1. Then you do that, because that will give you some time to think about yourself and the other person's response. And it can help you to kind of build up a more kind of meaningful feedback. The next strategy is to ask questions. So when you ask questions, be curious about the questions. So the question is what will help you to uncover the need. And so the question that you may want to ask is, what's important to you right now? What will you need right now to able to do whatever that kind of action that you want to take? And then the how is to strategies that how we can align on this. So how can we make this work for everybody involved? So that's maybe the conversation you have. But to keep this effective, you have to kind of ask the what and how questions and then pause for their answers or their response. So that's one way to get the conversation going. And so here's a case scenario. And so for instance, we've been like, you talk to the person. So we've been hearing multiple complaints about a medical staff from the medical office assistants. The communication is difficult. The dynamic has been unproductive. And the medical assistant has been mentioning that they feel bullied. And so the question is, what question will you ask to promote a dialogue that starts the understanding your medical staff colleagues and their perspective? Why would they get into this difficulty with the medical assistants? Okay, so the type of questions that you want to ask, there are different types, and the one that you probably try to avoid is the one here. Either it's a question or suggestions that sounds confrontational, although you are trying to find out the facts, but it will come across like a bit kind of judgmental. So why are you doing this, for instance? That's not a good start. Why didn't you do the other things? That can be accusing that they are not doing the right thing. And what about doing this? You're making suggestions that they should be changing, but you haven't even sorted out what's going on yet. And so what do you want? What do you know what I think? They certainly want to know what you think, but by saying that, you're already passing judgment. So instead, maybe you should be asked, what's going on for you? Like, what is your thought on this? What was going on for you in that moment? Like you're opening up the opportunity to try to find out more insight and about what's happening, and you open up the conversations. And what impact do you want to have? So you're referring the person's, making that person to take more charges of the situations, and what's important to you, and how can we achieve that? Now, another way, another kind of conversational strategy is to frame the conversation with what and why. So the what is what you want to talk about, and why is why you want to talk about this. And so some of the example is that who do I need to have a feedback conversation with? So you define who the person is, and what's the changes I'm looking for. So you prepare that in your mind when you meet, and what do you want to talk what do I want to ask their behavioral change? Like what do I want to get to the end result? Okay, so here are some examples that can help. And so the what is that, so first of all, I'd like to talk to you about joining a hospital committee. I think from some of the leaderships, you want one of the junior staff to be representative of the department. And the why is because I would like the department, our department, to have a stronger connections to the visibility to help us to get our need meet. And another example of what and why is that I want to check in to see how you're doing. I know that it's been a busy time and a lot of staffing challenges, and that may be the person why hasn't been showing up on time or having difficulty at work. So I want to make sure that you have what you need and feeling supported to collaborate with the other care team. So by opening up that kind of conversations, you are kind of offering an opportunity for the person to open up. And let's say if there's issue with incomplete charts or having problem with protocol deviations, so I like to check something out with you around the charting protocol and agreement. And you follow up to say, I want to make sure that all the provider in the same understanding how we all chart and address the concern that we may have from the care team so that we are all playing the same rule and standards. So you kind of lay out some of the discussion, the groundwork. So those are kind of some example that how you can start the conversations with and what and why to make it easier for the discussions. Now, another kind of opportunity is to give feedback. As a leader, this is often something that are meant for you to do. And most people are bad at feedback, both in giving and receiving. And that's quite common when you ask people. And but importantly, you have to understand the role. Our role is to help others to get the possible outcome with the feedback. So there are two types of feedback, so-called reinforcing feedback, that's the positive feedback, and then the corrective feedback that is trying, I don't say negative feedback, it's the feedback that you try to keep them back to on path. So what are the reinforcing feedback? The positive feedback is much easier to give because this way you basically tell the person how well they do, and it's actually important that you share this positive feedback to people from time to time. And not only that, you kind of tell them that to give people that sense of being positive and positive action plan will help them to improve. Even although they're already doing good, certainly it will be good for the team to get that sense of that they're doing on the right track. And in fact, people said a successful relationship, a romantic relationship, should have 20-to-1 ratios of positive comments to the negative comments. And so even in arguments between husband and wife, they still should have a 5-to-1 positive to negative feedback. I remember in the car, I was kind of have a conversation with one of my colleagues, say, you have to make sure that your conversation with your spouse, your wife, is good, because otherwise the rest of your day it will be miserable. So to maintain that positive relationship, you need to provide positive feedback. You have to, you can't complain, but food is not as tasty today. Wrong thing to say. You say, wow, this is interesting today. The food is different than what it used to be. I know that you must be taking time to do this. So give the positive rather than the negative, right? Even though you want to, you make sure your message is good. What is important is that if you try to avoid the conversations, it does cost the patients, and it may harm the patient. It may cause the problem to our staff, even our fellow physicians, and also importantly, it will reflect badly on you as a leader. So avoiding it is not going to be that helpful. And I was going to ask the audience, have you have any kind of experience of trying to avoid feedbacks? but I'm going to skip that. So sometimes people find that the feedback become one-way conversation, so I'm talking and keep talking. And part of the reason why I keep talking is because I feel uncomfortable. So I didn't know what to do. So I become the person who make the conversations. But the feedback need to be a partnership conversations. And one of the reasons why we don't want to talk about it is because we worry about it can go bad. And by doing so, you can thinking that, well, we should just skip this. And often, we are uncomfortable about this, so we didn't want to say the negative things. We try to make it a little bit easier, so we actually make the messages a little bit diluted. But unfortunately, by diluting the conversation, the impact of the conversation may actually become less. And sometimes you thought I waited too long, and so now we already missed the opportunity to change, so forget about the feedback. It's not going to make a difference. On the contrary, I think it will make a difference if you do meaningful conversations. And we have this technique about sandwiching. I don't know if you heard about it. You have a bad point, you put it in the middle, you sandwich it before the good comment, a bad comment, and then close with a good comment. Yes, it is a good way to deliver, but the message actually get confusing. So you tell your wife, say, wow, the food was interesting, but the wife didn't know that you didn't like it, right? So, but if you've been really honest about it, maybe the message will actually be clearer. So some of the strategies about giving feedback is what you should give it when things is happening. If you waited too long, sometimes people even forget what's happened there. They didn't even remember exactly the situations. And but also, when you talk about this, you need to talk slowly, and so that the message can be given properly. Be neutral, and be curious, and focuses on the kind of relationship of the discussions. And importantly, be specific and also objective. And make sure that you put them in context so that you're talking about this thing, don't talk about something else. Like that, maybe there's some other kind of behavioral issues, but that's not your conversation today. Today you're talking about this. And remember, as I said before, share the positive feedback that is important to make the other person feel valued. And ask permissions to discuss some of the other things that you may want to talk about, but don't assume that it is done. Now, I was in the workshop, they were giving us this so-called I-DISC model for the corrective feedback conversations. So what does it mean? Well, what is I-DISC? The D stands for the describing the relationship or the conversations, and the current behavior, and I is clarify the impact, and S is specify the desirable behavior. So it is a useful tool to guide many types of conversations, especially those difficult conversations. And so I think by using this model, you actually be able to do a two-way conversations. So, and most importantly, and the last step for the commitment to the next step. So here are some examples of how you use describe the current behavior. For instance, say, I notice, I understand that, and then ask, I want to check on what is going on for you. And what did you notice or experience, and what are happening to you here or there? And then clarify the impact. Say the impact of this is having, let's say, on our reputations, on how the patients feel, and how the clients feel. And I think this may impact how the nursing's practice and their response to you. And particularly important is that how it affects your colleagues. And then asked what might the impact, what might the impact or the risk of this being, and what's going on, what's getting in the way for you to able to do what you have to do. And it's important to specify the desired behavior. The goal is to, for instance, you want to say the goal, my goal, is for everyone to work on in the medical team to work on this. And I want us to work together so that we can achieve certain goals, and also need to be able to count on you, for instance, or count on the team. And so it's important to try to lean on the person's strength to able to get to your goal. And lastly is I'm committed to ensure that everyone on our team is able to do the result, the impact of the result. And so you want to find out, do you have the commitment from the persons to go together to achieve that? And I'm able to confirm that you are willing to do so. Now, here are some practical examples of how to improve the delivery of this DISC model. So for instance, like in a situation when people were having trouble on call, so I say I would like to talk to you about your accessibility when you're on call. I have noticed you haven't been answering your cell phone all the time when you have an on-call shift. And so it's important to try to keep it kind of light and try to have the open conversation. So the part here is to pause, to give that moment. And then you can follow up with, say, I want to check in to see what's going on for you. How are things going for you in terms of on-call shift and call? What has been your experience on call? How are the on-call shift going on for you? And so this way, you provide an opportunity to listen and to hear back the facts and ask questions and then try to understand more what's happening. And for instance, for this part here, for this conversation here, when you don't answer your mobile call during an on-call shift, it can create some complications which can impact the communications and lead to possible confusions and compromise the clarity of the care. If you say that, that seems to be quite judgmental. If you look at that phase, that part of it, and then you ask, what do you feel? Are you feeling tired during those time on call? So you're making already kind of assumptions. So instead of saying that, you could say, when you don't answer your mobile phone call during an on-call shift, there's a direct impact on the patient's care and the caretaker team on site also. And patients are at risk of not receiving the timely interventions, and the care team can get stressed and even further impact their patient care. And what's better to say is what is getting in, instead of saying that he's tired, you can say what's getting in the way for you to answer this call. In the interest of time, I'm going to skip some of the other examples. And so this basically is to try to help you to create some of the questions and try to get comfortable. And so another strategy is to frame those feedback is to kind of acknowledge what's happening there. So that's the yes, and then show understanding and build trust and keep them engaged and open. And I will give you some example. And then it's important to bring your perspective, and then this way you can have the opportunity to questions on the statement. And so you will say, I appreciate your perspective on this, and I'm wondering about what's happening. So here's an example, for instance. So the question is, I've been asked the same question 3 times in the past 2 weeks while on call. Are they even communicating with each other? So that's the question was raised by let's say your colleagues. Your response may be, oh yes, I understand. Yes, they are not confident team, and I'm collaborating with their ops manager to ensure that they know what's requiring a call in the medical support. So that's the yes, and as an acknowledgement. So again, the practitioner asked the question. Sometimes I just don't hear my phone. I'm pretty exhausted from covering all the shift that needs coverage. So as a leader, you can say, yes, you've been working a lot of shift. I didn't realize you were feeling the impact so much. And we are still responding to reply to all the calls when we are on call. So let's try to create a plan to coverage for everyone. So that's kind of like the yes and example to try to create some impact. So in closing, I think the leadership actually set the emotion climate of the unit. You being calm will create more clarity. And it's often difficult, so I think I'll post to the group and try to have a difficult conversations when it comes, and use the opportunity to reflect and to reframe and to grow from it. And so try to think of the conversation you've been avoiding and try to get to that. And that small action you can do may make a lot of difference in your confidence. And in closing, so leadership begins when the conversation gets started. And courageous conversation builds the culture you need. And so your next difficult conversations is probably your next leadership opportunity. Lastly, great leaders don't avoid tensions, they transform it. And here are some of the books, references you can use to help you to feel comfortable to lead those conversations. So I see about 10 minutes before 1 o'clock, and I'll open up for questions. It's probably a practice to carry on a difficult conversations as it is. All right?
Thank you.